Hi, my name is Dr. Debby Feinberg. I'm a neurovisual medicine specialist working in this field for over 24 years. The patients who come to me have a condition called binocular vision dysfunction. The most common symptom that patients come to us with is motion sickness. Patients will describe, even as young children, that they didn't feel comfortable on a swing, they didn't feel comfortable on a circular ride at the fair, they didn't feel comfortable in the car, especially riding in the back seat. They can sometimes feel better in the front seat, but when they get to be an adult, they must be the driver. That way they feel they can control their focus. When patients are driving on highways at these high rates of speed and they don't feel that they're in control of their vision, they will often get very anxious. They don't know it's even their vision, but they just know, I've got to get off this road. I'm feeling even panicky. Panic attacks and anxiety are just byproducts of one another, and they'll actually pull off the side of the road and feel like they have to take a deep breath. They're not even sure sometimes if they can make it all the way home. They just feel unsafe. So what's really happening with these patients? I'm going to use my hands to describe it. When the eyes are working in synchrony, we can handle images moving in our peripheral vision. But when our eyes are ever so slightly misaligned, we're actually picking up on images in our peripheral vision. In doing so, it becomes very disorienting and disruptive to our ability to stay focused on that road. Very often the patients will say, I don't do highways, I don't do the interstate. If I have to go in a vehicle, I know all the back roads. I go on the slow roads where I can control the speed. I recently read an article about Dr. Sanjay Gupta having motion sickness. And his description of what he's going through reminds me of many of my patients. Motion sick, wanting to be in the front seat, not liking to be in the back seat, long car rides being quite impactful, feeling like even after being out of the car, it can take sometimes a couple of hours to recover from those symptoms. When patients are supported and corrected with aligning prismatic lenses, they actually feel better. Their motion sickness symptoms go away. They can actually get back in the car and drive again on the faster roads, or even get back in the car and drive at all.